Assalamu alaikum. I'm Dr. Asad. I'm currently working as a consultant neurosurgeon. Today we will talk about brain tumors. Usually when the patient comes to us in OPD setting, we listen to his history carefully, and then we devise some specific test to diagnose that brain tumor.
What are the different types of brain tumors, and how do they vary in terms of severity and treatment options, and what are the common signs and symptoms that might indicate the presence of a brain tumor?
As you know, most of the people in the world, and especially in Pakistan, they suffer from this very lethal disease. A brain tumor is a very dangerous disease which involves brain cells, which leads to different malfunctions of the brain. First of all, I will talk about the symptoms which usually patients suffer from when they develop a brain tumor inside the skull. Then I'll briefly go through the diagnosis process, and then I'll tell you about the different treatment options, and then post-operatively how the patient comes out of that difficult surgery and post-op recovery. First of all, if we talk about the symptoms of the disease, usually the patient develops headaches. The specific and the very important feature of that headache is that the patient feels that headache especially early in the morning, and that is associated with the headache and vomiting. And depending upon the location of the tumor, patient can also have other symptoms like memory problem, like there is some difficulty in hearing, and the patient can have difficulty in judging things. Patient may have other symptoms like he can develop any weakness in the limb, right, especially in the upper or the lower limbs, or he can feel difficulty in speaking. The other feature with which most of the patient present is the development of seizures. Seizure is basically, we call it epilepsy, in which the patient develops sudden onset jerky movements, then which leads to the loss of consciousness. These are the major symptoms of the brain tumors with which the patient usually presents.
What diagnostic tests are used to confirm a brain tumor, and how does the diagnosis process guide treatment decisions, and what preoperative preparations are necessary for brain tumor surgery, including medical evaluations and emotional support?
Now, if we come to the diagnostic option, usually when the patient comes to us in OPD setting, we listen to his history carefully, and then we devise some specific test to diagnose that brain tumor. For that, MRI brain with contrast is the gold standard test. Apart from that, we can do other modalities like CT scan brain, we can do angiography of brain, and we can do as well ultrasound in pediatric populations. So what we see on MRI, most of the tumors, they enhance when we give contrast agents. So with the help of MRI, we define the tumor limits, the size of the tumor, the exact location, and the surrounding normal brain structures, which are very important because we have to preserve them while doing surgery. Because if we don't have the knowledge of surrounding brain tissues and we don't preserve them during surgery, then the patient can have post-operative deficits. So it's very important investigation.
What different types of brain tumor surgery are available, and how do they vary depending on the tumor location and type, and what are the potential risks and complications associated with brain tumor surgery, and how are they managed by neurosurgeons?
Depending upon the location of the tumor, there are certain things which we beforehand tell the patient that he can develop symptoms like weakness, numbness, some problem with speaking, or some kind of vision problem with the location of the tumors. And for that we call it informed consent. In this, the patient is thoroughly explained about the disease and the consequences which can develop after the surgery. And after explaining to them, then we do the surgery. Mostly for the brain tumors, we do craniotomies. craniotomy is a procedure in which we remove part of the skull, and then we open the covering of the brain, that is called dura. And then we have other technologies like image guided systems which tell us to where to go and which pathway we have to take to go through safely the tumor and to remove it safely. So after opening the dura, we usually slowly and gradually debulk the tumor, and by preserving the natural normal brain surrounding that neoplasm, and after that removing the whole of the tumor, we usually do the cautery to decrease the bleeding. And most of the time, if the patient is suffering from lethal brain tumors like gliomas, in which we cannot define the exact limit of the tumors, we usually go for subtotal resection, in which part of the tumor is there. And for that, post-operatively, we tell the patient to go to some radio chemotherapy to get the tumor burned. Of course, brain surgery is a very delicate type of surgery, and there are specific risks which are involved with each tumor depending upon their location. For example, if we are operating upon the CP angle tumor is just behind the ear. So when we are going to operate on such tumor, we have to take care of the hearing nerve, which gives you the sense of hearing. You have to take care of your facial nerve, which gives you the facial movements. And apart from that, the nerves which helps you to swallow the water and the food, they are at risk. So if we are operating on such tumor, we just tell the patient that God forbid they can develop these symptoms, but Alhamdulillah, we do it very carefully, and depending upon the tumor stage, we can preserve these nerves with the help of monitoring.
What should patients expect during their recovery after brain tumor surgery, including pain management and rehabilitation needs, and what types of therapy and support are crucial for recovering from brain tumor surgery and managing any potential cognitive or physical effects?
So after the surgery, usually the patients go to the ICU for a couple of days, and where we put them on ventilator, and then after that we wean off the ventilator, and then they are shifted to the ward. In the ward, they are being taken care by the doctors and the nurses, and the specific medication is been given. And upon full recovery in 2 or 3 days, when we consider them safe to go home, we discharge them home. In the post-operative period, especially in the home, they have to take the medications specially prescribed by the doctors, and in case of any unusual symptoms, if they develop, then they have to come back to the hospital as soon as they develop some unusual symptoms. Usually the stitches are taken out on the 14 days of surgery, and post-operatively, depending upon the tumor histology, we continue the treatment. If the tumor is benign, that's okay, then we have to just do the surveillance MRIs. And if God forbid the tumor is of a high grade nature, then we refer the patient for further chemoradiotherapy and further treatment. Usually post-operatively, those patients in which there is high grade tumor and they have to go through that treatment specific for that neoplasm, they can have complications like fits, they can have complications like any headache, vomiting, or any other symptoms which can appear with that remaining neoplasm. So majority of the tumors, if they are of low grade nature, after surgery, though they don't need any further treatment, they just need surveillance MRIs to look for their regrowth.
How do individuals manage the long-term impacts of brain tumors and treatment, including potential side effects and emotional challenges, and what support systems and resources are available for individuals and families impacted by brain tumors, both during and after treatment?
At our hospital, we have multi-modality tumor board meetings where we discuss these brain tumors, that how to proceed with the tumors, and of course if we do operate on them, we have special post-operative care units and rehabilitation units. And after that, even if we have some kind of tumors which are very sensitive to the chemotherapy, we have oncologists on board and we give them chemotherapy at our center. And God forbid if they have in need of some radiotherapy, yes, we refer the patient as soon as to the radiotherapy centers. And then we have the data of the patient, so we keep close follow of the patient.
What are the latest advancements in brain tumor research and treatment, offering hope for improved diagnosis, surgical techniques, and patient outcomes?
As you know, the world is fastly changing like the neurosurgeries. So we have a very sophisticated instrument which are used during the surgery to define our surgical resection limits. For example, we can use intraoperative monitoring. We can do surgeries when the patient is awake, and we just monitor it live, so that we preserve the normal brain tissues to having some kind of post-operative deficits. So apart from that, we have intraoperative MRIs, which are being very advanced setups of those things. Of course, there are other advancements like intraoperative dyes, which just make the tumor glow, and we can easily resect that tumors.